And in the process of learning about my children, I started researching issues in copper zinc imbalances in children with autism. And I ended up just attracting attracting a lot of families with kids with autism. And I've been doing this type of work with children on the spectrum since 1997. Been at this for a really long time.
Yeah.
But the group of doctors that take care of children with special needs in the functional world or biomedical world, we're called Medical Academy for Pediatric Special Needs, or MedMap. So a lot of the symptoms they have are related to what I would say excitation in the brain. So how would people present with excitation in the brain? Anxiety, OCD, repetitive behavior. Some people have seizures. Some people, they just can't focus. They just are looping, constantly perseverating. So there's a lot of excitation. The thought process on excitation in the brain is inflammation triggers excitation. So we take it a step further back, and it's like, well, what's causing the inflammation? And the main things that cause inflammation are infection, allergen, toxin, or a major stressor. There is this doctor named Dr. Quadros, who studied patients with cerebral folate deficiency. They did spinal taps, and they found that if you check their body, they had enough folate, but if you check their brain, they didn't. And he found that a lot of those patients had antibodies to the folate receptor that allowed folate to get into the spinal fluid and into the brain. So we can.
So the antibodies were killing it off and not allowing it?
Antibodies were blocking the receptor. So it's
right.
like something in your parking spot and you can't get into that parking spot.
Right.
There's two kinds of antibodies that block the receptor. There's blocking antibodies and binding antibodies. People with dairy sensitivities and issues with dairy tend to make more of these antibodies. Might be some cross reaction, like you react to the dairy and then you make antibodies to your folate receptor.
Okay.
The fancy word is molecular mimicry. We don't know all the details, but we know that there's an association between dairy and these antibodies. Now, if you can't get folate into your brain, you are more prone to having problems with speech. Your kid, it's also associated with having seizures. So there is a subset of patients who may have a seizure disorder, but it's really cerebral folate deficiency. So if you treat the cerebral folate deficiency, it might help with their seizures. So
yeah, because Honey told me about that. She said that you had recommended that she get that tested for the folate, and it came back positive that he has the folate deficiency, and so she stopped giving him dairy, and now he hasn't had a seizure in 13 years.
Yeah, so it wasn't just the dairy. Patients with cerebral folate deficiency, treatment for that is a dairy-free diet. But in addition to that, we want to give them a form of folate that can get into the brain. And we give them a form of folate called folinic acid, just regular folic acid. And there's a prescription version of that called leucovorin. And if they have high levels of blocking or binding antibodies, then again, we want them dairy-free. And then we would do a trial of leucovorin. And sometimes, again, when we give them the leucovorin, it helps them with their language.
Wow.
Yeah.